Good evening. This is Dr. Joseph Baker from the Limerick Chiropractic Center, and I want to welcome everybody tonight. For those of you who are guests and who are here for the very first time, welcome. Welcome to our conversation about rotator cuff and about how chiropractic is able to help you out. Now, for those of you who are presently patients at the Limerick Chiropractic Center, I just want to give you a reminder. When you're on tonight, hit the like button. Make sure that in the comment section as you're listening to this recording, as you're listening to the conversation, you're leaving me notes. Notes of things that, listen, you want to hear about. In fact, as I was introducing this conversation in the office tonight, I was already asked by patients of, so what are some of the things that I could do at home? What are some of the exercises? What are some of those simple things that allow me the opportunity of engaging these muscles and helping myself? Well, listen, if you have questions like that, don't wait. Don't wait for somebody else to write it in there. You put your questions in there. I want to hear from you. Now, the third thing is, like always, share. Share this information with your Facebook community. Listen, I don't need you to share this for me. You're already receiving this information. I know there's people in your circle of influence that they need to hear this information because they don't know what you know. They've never been to a chiropractor before. They have no idea what happens inside the four walls of a chiropractor's office, and yet we know one thing. If they're not hearing this better information, sadly, they're doing what most of Americans do. They're taking a pill. They're taking a pill. They're just allowing things to steadily worsen over time till they get to that point where, you know what? The conservative correction, the easy steps no longer work. And in fact, when they're up against the wall and now they're left with having to have rotator cuff surgery, that's not okay. And I'm going to charge you and I'm going to ask you to make sure that you're doing your part to let your friends who don't know what you know in on what we're going to talk about tonight. So, when most people think about chiropractic, let me think. They think about headaches, they think about neck pain, they think about low back pain. I mean, forgive me, but every time a new patient walks through the door, that's what they figure chiropractic is about. Whatever they walk through the door complaining of. And the problem is that as a chiropractor, we treat the body as a whole, not as these individual parts. You and I we're greater than the single sum of our parts. So we recognize that as we care for patients, if there is that joint, well, guess what? It needs to be moving properly. Whether it's called a spine, whether it's your knee, whether it's your shoulder or wrist, it needs to be functioning properly, and that level of communication between those structures has got to be at 100%. Anything less than 100%, it's a state of disease. When we talk about diseases, it's not living up to that potential that we have. And in fact, we realize that for so many individuals, they're walking around broken, thinking, this is how I got to live my life. I'm just stuck this way, Or, listen, eventually it'll get bad enough that I'm just going to have surgery. Most people don't think of rotator cuff when you mention the words chiropractic. So let me just forewarn you. When you look at your friend and you're saying, hey, listen, whether it's in the gym or at the dining room table, and you're saying, have you ever thought about getting checked by a chiropractor? First off, they're going to look at you and they're going to tilt their head and they're going to say, well, first off, I didn't think that's what they did, but, I also don't believe in chiropractors. Let me say this now. Your responsibility, just like mine, is to give them the information. Help encourage them, if they're open, to make those better choices. Listen, if they want to sit down and talk with me, if they want to have a conversation, that's exactly what's necessary. Because in the brief moment of helping to explain exactly, let me think, embryology 101, how the body was designed, how it was created, how it forms and functions. In the moment of not only describing that, but then demonstrating how when things are connected, our body works well, then things are not connected. Breakdown is to ensue. And we talk about rotator cuffs, and let me just tell you now, and I'm going to remind you, muscles are stupid. They only do what the nerves tell them to do. In fact, unfortunately, if we set ourselves up in a bad posture, in a bad position, now we're adding insult to injury, and guess what? Now what we're doing is we're putting them at a mechanical disadvantage. In other words, you're using a piece of equipment that wasn't designed to be used in the way that you're trying to use it. It's like building a house and thinking, well, hey, listen, I'm going to do something, and I could pick either a hammer or a sawzall. Both will do the same thing. No, they don't. Unfortunately, we have choices, and if we don't set ourselves up to have the right equipment being used, problems are going to happen. In this case, well, listen, the rotator cuff might be the right piece of equipment. It's the environment that's the problem. It's the fact that the posture was so far off that mechanically you're at a disadvantage. Now, the rotator cuff, without getting really into anatomy, there's 4 very small muscles that make this up. Really small muscles that work on stabilizing this shoulder of ours. Let's not forget, this is a ball and socket joint. The ball is the top of our arm, the socket is the scapula. And we don't think about, unfortunately, the fact that this big bone that's behind our shoulder is involved in our shoulder and the function of it, but it absolutely is. So in turn, we have a lot of small parts that are all coming together to make up what we recognize as the shoulder girdle. And the rotator cuff muscles, those 4 muscles, happen to be some of those. Now, unfortunately, because of the type of tissue that it is, well, when you injure your rotator cuff, we automatically, guess what? We get a combination of things going on all at the same time. We get tendonitis, we get bursitis, we have a strain, and sometimes we have a tear. And let me just say, none of those things, whether individually or in combination, is really good when we start talking about wanting to use this thing. I mean, listen, you tear a muscle, does that sound good? I mean, we don't have to have an advanced degree in anatomy and physiology to understand that muscle tear probably doesn't amount to 100% function. And if you're not familiar with the ITIS, that's at the end of the tendonitis, the bursitis, well, let me just explain that. That really simply is inflammation. You have just poked the bear. You've inflamed the heck out of those parts of the muscle, those parts of the tissue, and it's going to talk to you in the form of pain. So, oftentimes it's pain upon motion. Sometimes if you do it at the right place, you're going to get pain upon rest. Certain motions are more painful than others, and we'll get to that in just a second. But, here's the thing. Unfortunately, there are really common symptoms that come with rotator cuff tears, rotator cuff injuries. Now, when we start talking about kyphosis, I'm just going to paint the picture. And you figure out if you know somebody like this. People start getting into, instead of their posture being up and back, they start getting into a position like this. Now, listen, this is uncomfortable for me to even stand like this. But this is the way people get positioned. They start rolling their shoulders in. They just start getting a hunchback because they get to take stress and pressure off of this rotator cuff that's inside their shoulder. So, in turn, they assume this new position. Well, listen, I'm not going to stay there very long. It hurts me just standing like that, because it's not normal. The other really common things is when you just simply try and reach up. When you try and reach up in order to grab things off the top shelf. when you're trying to push forward, it also can be painful upon action. And then, listen, if you're moving this shoulder, you know, if you're moving the arms very suddenly, it can produce that sharp stabbing type pain. Or moving the arm in the backwards motion. You're probably going to notice this motion, those two positions, this and that, look very familiar, don't they? Baseball, football, if you think of the tennis position as you're trying to serve, all those racket sports that use overhand motion. See, oftentimes we just equate rotator cuff problems with, let me think, athletes. But that's not the case. That is definitely not the case. There are non-athletes that develop rotator cuff injuries all the time because, well, because of our work, because of the repetitiveness of our work. Sometimes because of the really bad posture that we assume, it's one of those things that actually creates it. Now, commonly, you're going to see up here, listen, it's really typical. You know, what do most people do? Most people take medication. You got a pain, I got a pill for you. Hey, listen, you know, I don't need to go to the doctor. I just pop a couple aspirin. Give me some non-steroidal anti-inflammatories, they're called NSAIDs. Oh, I'm good to go. It takes the inflammation rate out of it. You know, I'm good for another 6 to 8 hours. I can at least get to sleep. I can go through the night. Sound familiar? Oh, by the way, you stop taking one. You start taking 2 or 3. You don't do it once a day. You're doing it 2-3 times a day. And unfortunately, those choices lead to other things. So this is not a chiropractic thing, and I'm just going to read this to you. If you want this information, do me a favor, leave it in the comment section. This comes out of some research that was done by the FDA. They actually put a black box warning. Now, listen, if the FDA tells you that something is not good, if they give you a warning on it, listen, generally speaking, bad stuff is going to ensue if you continue. Because they pump all different types of junk out onto the market, all types of stuff that's absolutely horrible for us, and they don't give any warnings, okay? But they actually put a black box warning on the non-steroidal anti-inflammatories because of the risk of heart attack, stroke, and GI bleeds. That's not me. That's the FDA. That's the Food and Drug Administration. They recognize that this stuff is not candy, that even though you can go into the grocery store and purchase it, or you can go into CVS or a Walgreens, you could send your 10-year-old in to buy a bottle of this stuff. It doesn't mean that it's less bad. In fact, we're going to get to an interesting point in just a minute. Overuse can trigger what's called rebound inflammation. Some of you might have experienced this. You're used to taking stuff for your headaches. And if you take too much of it, guess what? Your body has a different reaction. It doesn't wind the headache down, it actually makes it even worse. In fact, if you ever tried to withdraw away from a medication like this, you're going to figure out really, really quickly you have to withdraw slowly. Otherwise, you're going to have that rebound effect. And if somebody's been on this for long term, you have to do a scheduled detox in order to actually help to reduce the effect that this has. Your body is addicted to this. It is not candy. It will get an addiction. It changes the physiology. So in turn, it's able to create things like autoimmune diseases, like leaky gut. In fact, it inhibits what's called the cartilage regrowth and bone knitting. Now, I know for some of you, it might be a little bit of a stretch. Bear with me for just a second, because I think this is really important. There's a reason why orthopedists don't recommend non-steroidal anti-inflammatories when you break a bone, because they know it's going to slow down the bone's ability to regrow and knit together. So, an educated general practitioner or orthopedist is going to say, well, you have a broken bone, let's not do that. You have this inflammatory process, let's not do that, because we don't want to slow it down. In fact, not just the bone, but the cartilage regrowth is inhibited. That means if you damage your knee and the meniscus is all torn up, or you have some damage into the labrum in your shoulder, well, taking a non-steroidal anti-inflammatory, it might feel good at first, but what it does is it sets you up in the future, that next episode that's coming down the pike, for you to have an even worse time of it. It literally takes that bad situation and sets you up for a much worse one next time. And it's not okay. Because in turn, unfortunately, like we said, these medications, they increase your rate of cardiovascular disease by 1/3. In fact, you are 5 times more likely to get an ulcer. Now, I'm not sure how many of you have ever had an ulcer out there. Not a real good thing. Body doesn't heal really well when we're talking about things like that, inside the stomach, inside the intestinal walls. If we want to have just one reason not to take these things, this one slide would be exactly it. And I'm going to encourage it. Lancet, the FDA, they all have the same information. They all recognize that in the end, trying to do this patch and actually just kill the pain doesn't help. It only sets up for future disease, future breakdown, and more damage. Not the choice that I would hope any of you would take. That's why I ask you to share this with your friends, so that at least they know that, hey, listen, if I'm taking this stuff, I'm at risk. And I need to get off of this sooner rather than later. Tag them. Let them know. But let's take a look, and just for a few moments, some of the ways that actually chiropractic can help. Because when we talk about shoulder pain, things like tendonitis and bursitis, and these are inflammations that occur in the muscle. The bursa is that little sac that cushions the muscle so that it's not rubbing right up against bone. Well, we realize that inflammation is only that your body's way of describing there's a problem. So anytime that your general practitioner or an orthopedist says, hey, listen, you have arthritis, bursitis, tendonitis, recognize it's like the red oil can on the dash of your car. It's telling you got the problem. It's just not the root cause. It's telling you that you have to stop and address it, but it's not where the origin happens to be. Because if all we're doing is dealing with, well, the little red can that's on the dash of your car, put a Band-Aid on it, well, oil is never going to get in the car. So we need to do a couple of things. Number one, we got to make sure that your spine is in good alignment, because the health of your body is in direct proportion to the health of your spine and your nervous system. Your brain creates a signal at 100%. It needs to be able to get it, in this case, to your rotator cuff muscles to make sure that they are actually firing the way they're supposed to. Now, number two, we need to make sure that we're correcting your posture and the alignment in your shoulder. So we need to make sure that we're checking those shoulders so that your body is able to function as easily and with as little stress as possible. Some of the other things like the cold laser, the ice, these are natural things that could be used in order to help to rebuild and calm the inflammation down, so that as you're retraining and getting your posture back into place, and as you're bringing this structure back to functioning better, guess what? You have the time. You're creating that help for yourself that's natural, that doesn't have side effects. And here's the thing. Yes, we could have talked about probably a half a dozen different exercises too in this workshop tonight. I'm going to encourage you, leave me a note. Leave me a note so that I can come back and talk about this stuff. When you ask me, we want to make sure that we're giving you this information. So I want to make sure that we're always doing that very first thing for anybody that we know that might have difficulty where their body's not functioning properly. Let's make sure that their posture and their spine is positioned properly so that their body is able to communicate at 100%. I'm going to ask you, who do you know now that you're thinking about in your family, in your friends group, your coworkers, that doesn't know what you know? That simply needs to hear this information of, hey, listen, you know what? I know you've been dealing with this for a while. I know you're frustrated. Have you ever thought about getting checked? Encourage them. Whether it's at the Lumber Chiropractic Center, whether it's anywhere else, go get checked. I only know one thing. I only know the fact that, you know what? Lives are at stake when we don't speak up. And if you're thinking that, hey, listen, it's just something that doctors say, well, let me tell you, it's not. So I'm going to end our workshop tonight with one of our patients and their story. One of our patients, his name was Tom. His wife was a nurse, was an OR nurse. She worked at a local hospital. And he came in one day and he was letting us know that, you know, he had to leave, and unfortunately his wife was having a difficult day. See, the difficult day happened because working in the OR and one of their patients had not gotten up off the table. 40, 50-year-old gentleman, family at home, waiting for him to get released from a routine rotator cuff surgery, just having things cleaned up, ended up not getting off that table. We talk about these things because they happen in our backyard. We talk about these things because they are real people to us. I recognize that our community needs to hear that they don't have to be one of those statistics. They don't have to be one of those individuals who doesn't get up off the table, who ends up getting a post-surgical infection, having one problem that leads into the other. And oh yeah, by the way, since surgery is never 100%, recognizing that they might be one of those individuals that their problem doesn't get better just because they've had this surgery done. I'm going to encourage you not to share this for me, not to share it for yourself. Share it for the people that are out there that need to hear this information. I'm Dr. Joseph Baker from the Limber Chiropractic Center.